This is a formal council committee. The public proceedings will take place live on the internet, and it will assist with the conduct of the business if participants speak only when invited. And I shall adjourn the meeting if necessary if protocol is not observed. Members of the public are welcome to view the proceedings but should not make contributions until they are invited in line with our procedure. All members of the committee have received the report and associated documents in advance and have had the opportunity to read them. The public reports are published on the internet. All participants should mute their microphones and video feed when they are not speaking. And please remember to unmute your microphone and speak on your video feed when it is your turn to speak. Switch on your video feed, sorry, when it's your turn to speak. I think it's a catchphrase of the age is you're on mute. So if you can try and remember to unmute yourselves. Speak clearly and slowly into your microphone. Anyone wishing to speak should indicate using the raise your hand button on Microsoft Teams or wave at me if you can. I will invite people to speak at the appropriate time. If you do not have the hand button, you can use the actual keyboard to type your request. Now, please note that the chat function is monitored and has a full audit trail. And if anyone is found to be misusing this function, they will be removed from the meeting. Finally, I ask for everyone's patience with the use of technology, and I do apologise in advance if we experience any unforeseen difficulties, which we shall try to resolve expediently. I shall now follow the agenda items as stated. So, agenda item 2, are there any apologies for absence?
Yes, Chair. Tim Reid, the co-opted member.
Right, okay. Thank you. Agenda item 3, to report the appointment of any substitute members serving for this meeting of the committee. I take that that's a no then.
None, Chair.
Right, okay. Agenda item 4, to receive any declarations of interest under the Members' Code of Conduct. None, I'll take it then. Agenda item 5, to confirm and sign the minutes of the meeting held on the 9th of September 2020 as a correct record. Does everyone agree that the minutes are correct?
Yeah. Yeah.
Great. Thank you.
Yeah.
Virtually signed then. Thank you very much. Agenda item 6, which is the Children's Service update. And we've got the Acting Director of Children's Services, Helen Ellis, to verbally update us. Thank you. Helen, over to you.
Okay, thank you, Chair. Okay, I'm going to give you a verbal update, and as part of my verbal update, I'm going to ensure that I'm going to cover what's happened during the Ofsted assurance visit as well, just so members have some of the information. Okay, so the last few months have been really challenging, as you can imagine. Working through COVID has been quite a challenge. Ensuring staff are working within some of the buildings that we're attempting to open, but I'll explain more about COVID. But it is fair to say that it is quite a challenge working in the confines of the COVID restrictions. But within it, one of my priorities has been to try and secure the leadership team within Children's Services. I'm pleased to announce that both Andrew and myself have been permanently appointed into the Service Director's role. We've appointed the head of safeguarding, so it's a lady called Nicola Hale. Nicola will start with Dudley at the beginning of January. And we've got our head of children in care, Heidi Henderson, who will hopefully be joining us next week. So we're on our way to permanently appoint a number of the vacancies within the leadership team. We are going to be recruiting the head of education outcomes and inclusion position next Wednesday. We've got the interview process and panel. In terms of COVID, as I mentioned in my introduction, we've got in July, we opened our contact centres and our 5 family centres. Those remain open. during this second lockdown. Our centres are still open, and we're on target to open Corbin Road next Wednesday on the 18th of November, and we'll continue to do that. And that is predominantly where the majority of our social workers are based. So we'll continue to do that, and we're continuing to carry out visits, both from an early help perspective and from a statutory social work perspective as well. So with the right PPE, etc., we're still visiting children. In terms of Liquid Logic, we've really worked hard, particularly over the last couple of months. So despite having Ofsted, we've continued to ensure that we've hit every deadline. We are still on target to go live on the 16th of November. So I know a number of you will be really pleased to hear that, because I know a number of you have been on the journey with us over the past 3-4 years. So I'm pleased to say that we're working really hard this week. This week in particular has been a real challenge to try and meet all the deadlines, and we'll be working hard this weekend, and the official sign off will happen on Sunday afternoon, but it's safe to say we're on target. From an education perspective, we're continuing to support schools to remain open. We have had to close some schools because of COVID positive results, both from a children perspective and from a staffing perspective. But we will continue to work through that. Attendance is looking at about 80 to 85% attendance, so attendance is still pretty good, considering all the issues all of our schools are facing at the moment. And again, within this, I just want to thank our schools, because they're all working really hard to ensure schools remain open. From a SEND perspective, we're continuing to make improvements. We're working hard. As I said, so with the challenges of COVID, we're still marching forward with our improvement journey, and we'll continue to do that. From a social care perspective, we've got our improvement plan that was endorsed last week from the improvement board. Again, there's a number of challenges within social care, and I'll describe those shortly when I update you regarding the assurance visit. But we continue to work hard. But I think it's safe to say, and I need to be I need to be very transparent in the sense of that we've got a lot of work to do within social care. And just to say, just to give you a feel of the numbers of what the MASH are currently dealing with. So in September we had 1,299 contacts going into MASH. In October that reduced slightly to 1,051 contacts. So we are dealing with a real heavy workload of contacts coming into MASH, as well as on average working with 1,000 families within early help at any one given time. So it's just to really cite scrutiny on the challenges around how busy we are in children's. In terms of the Ofsted assurance visit, as you know, that was conducted between the 13th and the 15th of October. That's when the field work happened. Ofsted aren't carrying out inspections under the normal social work regime. Assurance visits commenced September 2020 across the country. During the recent assurance visit that was conducted, Ofsted considered findings from the Children's Services inspection, which was conducted October 2018, and that's where we were judged as requires improvement. They looked on at areas of strengths and improvement, which were identified in the local SEND inspection, which happened May 2019, and they also considered the findings from the focus visit, which was conducted December 2019. Ofsted evaluated the experiences and progress of children and young people, taking in account the COVID-19 context, how well children and young people are helped and protected, and then the effectiveness of leadership and management, including arrangements to meet the needs of children as restrictions eased during the summer. Ofsted will not include a graded judgment in the published report. The report will state whether inspectors found any serious or widespread concerns for the welfare of children. And the report will make requirements and recommendations for improvement. I can assure the scrutiny this evening that all the findings were reflected in our improvement plan. So before Ofsted arrived, we already had a robust improvement plan of which we gave to Ofsted, and they were assured that we were very self-aware. And that improvement plan is the plan that we're working to currently. We received we received a draft letter, and we sent it back challenging around factual accuracies, and the letter will be published on the 27th of November. Okay, and that concludes my update. I don't know whether anybody's got any questions.
Right, I'm actually not seeing any hands up on this, and I do know we've got a problem. We're trying to get Christine in. So hang on, there is a hand. I'm not quite sure who it is.
It's Councillor Sahota.
Yes, yeah, it's Parmjit, please.
Thank you, Helen. Can you hear me?
Yeah.
Thank you, Helen, for the detailed update in terms of obviously what's been happening. And I think my only concern, obviously, is that obviously we've had this Ofsted inspection. Now you've given us a verbal update in some sort of a key summary, but I think it would have been nice to actually, as a committee, to have like a small note to basically say these were the issues they've identified. These are what we're doing, etc. And so at least it would have had, we could have been assured of, something we could see ourselves in terms of what, as a committee, of what the issues are and how you were able to sort of negate those concerns, etc., rather than just having like a detailed update. I'm sure that could have been possible.
Yeah, can I just interject there? We have had a discussion regarding this. And when that letter goes on, is it the 25th, Helen?
27th.
Sorry, 27th. And obviously, we will have sight of that, won't we, Helen?
You will.
Yeah,
We couldn't.
Yeah, you couldn't do it beforehand because
No.
this is embargoed, Parmjit. So perhaps
Okay.
that was just remiss of me to say, that Helen didn't point that out, but
Okay.
yes, we will be informed. So you make a very good point, and that is covered.
Yeah.
All right.
I'm sorry about that. I should have made that a bit more explicit, that currently the information's embargoed, hence why I couldn't give the detail this evening, but we definitely will be bringing the detail to scrutiny.
Okay, thank you.
Also, Helen, I'd like to say, congratulations with Liquid Logic. I know that Councillor Ridney and I
Yeah.
champagne corks, I think,
Yes.
or virtual champagne corks when that goes live, because we go right back to the early 2000s where we flagged this up, and it was an issue then. And yeah, it has taken a while, but of course people have come and gone. So that's a really good thing. The other issue I wanted to just ask you about with regards to the MASH and the increase in caseloads, what type of contacts are we having, Helen? are they telephone calls to say that, you know, we're struggling with food, or are we having what I know that I've had as a local councillor, vexatious reports?
Okay. Andrea, do you want to answer this one?
Yeah, I think what happened when we went into lockdown, um, obviously with the pandemic, there were some restrictions on some of the services being offered. I can hear an echo of myself, so bear with me, it's a bit disconcerting. So
Can
what we
everybody
found,
mute on the mute, please? If everybody mutes, the link's better if you everybody gets off the video and off the microphone, please.
So what we found, there was a 3-month period where we had at the beginning of the pandemic, we had a really low rate of referrals, and that was national across the country. And then sort of June, July, August, we started to get a higher rate of referrals. And when we've analysed that, a lot of quite a number came from health, and when the schools went back, we had quite a number from schools, as I'm sure you can understand. So when we've looked at them, there have been some that have come through to us because there's been a raised sense of anxiety, not just across professionals, but from some of our, you know, wherever we get referrals from, there's been that anxiety around children, which is understandable. So we've had to work through those contacts to make sure that do they actually meet the threshold for social care, or is it appropriate for us to send them down to early help? So we're doing some work across the partnership with the MASH operations group and doing some analysis of the contacts so we can have some definitive analysis of that. So that work's happening now, so we can make sure that we have an understanding about the types of things that are coming in, but also that we can share that across the partnership. But there has been a surge. Some of those things, we've looked at them, they probably shouldn't have come to us, but we want to work with partners to get a better understanding around the threshold.
Oh, that's really good. And if we could get an update on that at the next scrutiny meeting, I think that would be really useful, just to see, as you say, did they meet the threshold? Was it just because people are aware of us that, you know, in a bit of a panic, they will come to us when really they don't need us, and we can signpost them elsewhere. So thank you for that, Andrea. I believe Councillor Sahota's got his hand up again. Jim? No, I think he might have had his hand left up. Anybody else?
I'm here. Yeah,
Oh, do you want
sorry,
to
I'm here.
speak? You want to speak, Palmjit? Yeah.
Yeah, sorry. I think the other thing I want to sort of ask Helen, obviously, Andrea, is obviously children's services are a key department supporting children. Now, obviously, with the pandemic, etc., that's put a lot of pressure on the actual frontline staff. You know, I'm married to a social worker, so I understand it's a very difficult job. How are we, as a responsible employer, making sure that we are supporting all our staff, whether it be social workers or other sort of workers, to sort of deliver their services, but also to make sure that because of stress, etc., they can continue to fulfil their role going forward?
And I think, and thank you for recognising the pressures, actually, Councillor Sahota, because as you said, it is tough. And I think as the year's gone on, it's become more challenging, because I think staff are beginning to become quite tired now as well, because it is really, really intense. So we're very aware of this. So in terms of communication is absolutely key for us. Having that clear line of communication to our frontline workers, ensuring that line managers are working and supporting frontline workers, so making sure that there's team briefings, there's time for reflection, they're meeting as a group, having coffee and meeting, being able to speak to one another. And this is one of the reasons why we've worked hard to get Corbin Road up and running, even though we've recognised we're into a second lockdown. We felt as children's services it's important for us to have that hub open, so staff can start working with one another more physically, albeit within COVID restrictions. So we're having to adhere to all the restrictions. So we are very aware that we have to really do whatever it takes to make sure our frontline workers are really supported. HR are helping us. We've got a counselling line as well that staff can access. There's quite a lot of emotional health and well-being support as well. I mean, I don't know whether Andrea wants to kind of add any more to that.
Yeah, so we, like Helen said, we looked at to making sure that we've got regular meetings in with staff and we've got a proper schedule that we're tracking. In addition to that, today I chaired a meeting with the Safeguarding Partnership. So after the first lockdown, it was important for us that we got a sense of what the partnership was doing in terms of families and supporting the community. And certainly for social workers, obviously for our workers, they go out anyway using PPE and practicing safely. We still have to go out and make sure children are safe, but it was trying to understand what does it mean for the other professionals and the other partnership, and getting everybody in a room to talk about who's going to be going in, what might be done virtually. So it was a really helpful meeting, and that will be shared not just with children's services but with the partnership then, and it means that everybody can have a really good sense of, I'm not the only person knocking on this door and supporting the family, but there are a number of other professionals. So I had the hospitals there, health visiting, mental health services, police. So we were able to say who's going to be doing what, not just for this period of lockdown, but as we go through the pandemic, and we'll meet every 6 weeks to see how we're doing. And that for our staff will mean that they don't feel that it's just them, but they can say, I'm not the only person visiting, but we're all sharing the load together.
You're on mute.
You're on mute.
I just want to welcome, obviously, the reassurance. In terms of sickness, Helen, obviously, is a sickness record similar to last year, or are there any like pinch points, like if you did heat maps in certain areas where there's high level of sickness, and how we're sort of supporting people in that areas?
Yeah, I mean, we're starting to experience more sickness now, more so than we did it with the first lockdown. We're keeping an eye on all of those sick. And there are pinch points within frontline in particular. There are, and they're not always COVID related either. But we're working very closely with HR and ensuring that the welfare support is in place. And as we said, we are keeping an eye on the situation, because that bears pressure as well on staff that are in, and then it's cover pressure as well. So it is a challenge. I mean, it's fair to say it's a challenge trying to juggle it all, to be honest. You're on mute, sorry.
You're on mute.
Okay, I'm going to finish now. Sorry I've gone on a bit, but I think it's a valid point. In terms of resources, if they are pressures to sort of plug the gaps, is that an issue? Is that an issue going forward? Because what we don't want is then there's financial pressures and you can't plug gaps, and then things sort of suddenly sort of start breaking down. Am I being a bit too concerning, or is that a valid point?
No, I think it's a valid point. It's something that we've got to monitor, because it will bear pressure if we can't cut the work. As you know, Councillor Sahota, being married to a social worker, you have to cover the work. We can't leave the work, and that's the challenge really for us. So again, we are struggling to recruit permanent workers because people are not wanting to move from their locations because of COVID. So, in the past there was that flow across the country, across the region. Staff are very wary about that, about working across, and we as a region are keeping an eye on that at the moment.
Thank you.
Okay, thank you.
Thank you very much, Helen. I don't think anybody else is indicating they wish to speak. But sorry. So who's
It's me.
Councillor Ridney.
Oh,
It's
sorry. Yes.
I'm only just saying thanks very much, Helen, for that update. I do appreciate how difficult it is, and there has been a lot of pressure, and the sickness levels are rising, as they are in our schools as well. My own school tonight's rung me up to say Year 6 have got to go home tomorrow for 2 weeks. We've got one case, and that's our first case I thought we would have more being on the border, but that's for tomorrow. So yes, well done. It is very difficult, and I'm really pleased about Liquid Logic. I can't tell you how pleased. I just, when you were saying, oh, that's been ongoing for a couple of years, I thought, no. We're well into our teens here. We are with this, so let's hope that the sooner it's up and running. I do understand, because we've had a talk about this, haven't we? There will be a slight drop, because until people get used to it, but at least we've managed to keep up the training, and that's so well done with that.
Thank you. And thank you, Councillor Ridney. It will affect our performance. There's no two ways about it. It will affect performance, because it's a huge system change. Yeah. Thank you.
Right, Christine, I believe you've got your hand up as well.
I have, yes. I do apologise. I've been trying to get in since 10 to 6. And so I've had to phone Democratic Services, as you know. So I've missed half an hour of what you were saying. So were you talking about children in care?
I wasn't talking about children in care specifically. I was giving a general overview of children's.
Oh, right. Because
we haven't got on. Christine, we haven't got on to the main agenda. This is just Helen's
sorry
verbal
about
update.
Do apologise.
That's all right. Right, well, thank you very much indeed for that verbal update, Helen. Can I just remind, is that Councillor Ridney again, or have you still got your hand
Oh, no,
up?
sorry. I'll put my hand down, sorry.
Okay, so did you want to ask a question, Christine? Just take your hand off. Right, thank you very much indeed for that, Helen. So if I can move on to agenda item 7, which is the Independent Reviewing Officer Annual Report, 1st of April 2019 to the 31st of March 2020, pages 1 to 23. Now, who's going to be presenting this? Jasmine and Helen. Right,
Jasmine.
okay. Welcome, Jasmine.
Good evening, everyone. So I'm Jasmine Walker. I'm the acting head of safeguarding at the moment, and my substantive post is the service manager for the safeguarding and review service. So just bringing up the report for you. Can everybody see that?
Yeah.
Okay, so my substantive post is managing the independent reviewing officers. In Dudley, the independent reviewing officers review children's cases where children are subject to either a child protection plan or children who are looked after. So we have a dual role in Dudley, and this report outlines and meets the expectations outlined within the IRO handbook, which is our statutory guidance. So this introduction just outlines what the report should include, and then each of these bullet points are covered in each section of the report. This first section looks at what our key areas of focus were outlined in our last annual report and gives you an update as to where we are now. So in regards to the voice of the child, one of our primary aims is to increase the number of children that chair their meetings. And we did a survey with children and young people that evidenced 30% had been asked to chair their meeting. Continuing on with the theme of participation, restorative practice is the local authority model, and there's been some key areas of work looking at taking forward restorative practice, and currently our child protection conferences work to that model. And again, in regards to restorative practice, we have had some challenges in terms of restorative, and there has been some delays in moving that forward, but that's by the changes in senior leadership, but that's now back on track now. Again, some reference here to successor and the independent reviewing and officers' role in contribution to that. And then this last area is in regards to effective challenge. So it's the IRO's role to feed back to the local authority both good practice, which is outlined in the report, but also to pose effective challenge where children's care plans are experiencing drift and delay. And for the first time in Q4, there was a quarterly report that outlined the activity that was taking place in regards to that, and that activity is reported later in this report. And then in terms of emerging themes, the local authority developing the response to contextualised safeguarding, and we've been involved in some auditing work that has informed the service plan and what needs to improve in the Iro service. So this first section outlines the establishment of the Iro service and outlines the key roles and responsibilities and the additional responsibilities and support that IROs support the local authority with, so attendance, for example, at the Access to Resource panel. And there's just some information here in terms of how the establishment reflects the children that we work with, and the numbers of children that we've worked through across the year, which has been relatively consistent in terms of the numbers of children subject to child protection plans and the numbers of looked after children. Section 2 looks at participation. There's been some huge developments in terms of how we've involved children and young people in care in the development of the service. So there's two elements to participation. One is how children are involved in their casework, and an example of that would be chairing their own meeting. And then the other area is where the children and young people shape the services and are consulted about the services that we deliver. So we've had two consultation events with children in care. One was a survey which will now be taking place annually, and the other was a joint event with the Children in Care Council, where we met with a group of young people in person. We obtained feedback, but we also provided some support to help them be able to facilitate their meetings in the future. And then this section continues to say how IROs engage children and families in their own looked after reviews or within their child protection conferences. In terms of advocacy and independent visiting, the numbers have remained pretty static really over the last financial years, and that's one area of improvement that's outlined at the end of this report. The next section looks at our performance, so the timeliness that meetings take place, and in terms of children in care reviews, our timeliness across the first half of the year was pretty good, and we were generally meeting or close to meeting that 95% target, and that target's now been increased to 100%, and that's the aim. So we're not meeting that currently, but we've set a high bar in terms of expectations there. In terms of child protection conferences, the number of initial child protection conferences that are held within 15 days of a strategy discussion, our target there was 80%, and that's now been increased to 90%. And again, you can see through later for the year we would have been meeting that 80% target, which is why we've raised it to 90%, because we continually want to seek to improve, and the statistics there for review conferences are similar. In Dudley, we complete progress reviews. So this is where in between those formal meetings, IROs are expected to have a footprint on the child's file and to review what's happening for the child and ensure that the plan is making good progress. And then this section outlines the dispute resolution process, which is a way of IROs providing assurance and feedback to the local authority and challenging where a child's plan has experienced drift and delay or where needs are unmet. And I referred to the fact that we are now completing a quarterly report. That quarterly report is shared with senior leaders within the council, the department leadership forum, and we can see here that there's been an increase in the number of dispute resolutions raised. So IROs are raising concerns on behalf of children and young people. Some of those reasons are around, so the top reasons for informal DRP. So we try to resolve issues with the service areas, social workers, team managers at the earliest opportunity, and we do that informally through conversation initially. And so we've had the majority of concerns there around pathway plans or care plans not being completed within timescales, or there's outstanding actions on the plan. And those concerns are reflected also in those formal dispute resolutions that have been taken to the next stage. In regards to good practice, we've had some examples where social workers have gone above and beyond the children that they work with. We've got an example here where a child who was 17 who became looked after because we knew she'd be turning 18 soon, the duty and assessment social worker continued to work with that young person rather than her needing to have a new social worker. As you can imagine, social workers in the duty and assessment team not experienced with looked after children and children who are being prepared for leaving care and care leaver services. And actually this social worker went above and beyond to find out what her responsibilities were, and made sure that this young person was appropriately prepared and supported, for example, with securing a grant for a laptop and for furniture for her new property. So that's a really good example there. This section of the report looks at the business support that supports the effective delivery practically on the ground, and some changes that have been made to ensure that that is robust and that we're delivering the most positive outcomes for children and young people. And then just to summarise, some of the key strengths of the report and of service delivery in this year has been that participation of children in service delivery, that consultation has taken place, and the progress reviews and the increase in dispute resolution and effective challenge. And some of the areas for improvement are in obtaining feedback from wider service areas, so around parents, participation, improving access to advocacy service and independent visiting, and also meeting our performance targets, which, as I've outlined, are ambitious, but that's what we strive to achieve. And also that the IRO service plays a broader role in driving learning and improvement across social work teams, and that's taken forward. So that really is the impetus for our service objectives for this financial year. So you'll see here that in terms of consultation, we're aiming for one form of feedback activity and consultation to take place every other month, including our partner agencies and parents for both child protection and for children looked after. We've strengthened the business support, supporting reviews. We've completed a You Said We Did poster following the consultation that took place earlier in the year. And we've set up a number of working groups to further strengthen participation within the service, so they're outlined there. And in regards to improving the use of advocacy, this is now a standard agenda item in IRO's annual appraisal, supervision and team meetings. And we've now made a change where IROs were leading on those groups, so meeting with the advocacy service. Now service managers are attending those meetings to really ensure that oversight is there to increase the advocacy and use of advocacy. And then in terms of effective challenge, we've made some changes there to increase the robustness of challenge and that follow-up, so they're making sure that sticks to the statutory timescales that are outlined, and adding to the learning and development offer both for IRO's professional development, but also the role that the IRO as social workers and managers can offer to support the social work practice within our teams. So that's an overview of the report. I'm happy to take any questions. Councillor Craig again.
Hang on a minute, on the chair. I'll take everybody in order that comes on here. Can you remove the slides from the screen, please? Right, this is Chair's prerogative, so I'm going to ask a few questions. Thank you for the report, Jasmine, and it's good to see that starting on page number 21, we've got the service objective, of what needs to be done, because I've got to say, this report was alarming to me. If I look at a question on page number 2, paragraph 5, which says that during the reporting cycle there was no way to measure whether a progress review had taken place. We look at paragraph 7 that says that there has been no service data collected or feedback obtained from children or their parents involved in child protection planning during this reporting period. This is a service that is for children and it gives them a voice, but nobody seems to be taking any notice of them. Perhaps that's unfair, but that's how the report reads to me. I also noticed that on page 11 at paragraph 2.1, the postal survey was sent out to children in care. And and it was completed by 57 children, which equates, if you look at the table above, approximately 6% of all the children in care, which is 94% didn't respond. I know how difficult it is to get survey responses, because we do this on a regular basis as a political party. But it may be worth in our recommendations that when children do have interaction with the IRO, that this is captured at that meeting, so that you don't have to rely on the actual postal survey or somebody throwing it in a drawer or in the bin. Also on page 20, there's a number of points about IROs not evidencing challenge, undertaking and recording use of informal DRP, plans and evidence tax being repeated and not justified. Many cases have plans that do not change from review to review, even though actions are said to be complete. I'm a bit concerned about that, because a child's needs do change, so what's going on there? And there appears to be drift and lack of focused direct work within the 16 to 17-year-olds. So there are a number of issues there. I'd like to know how that's going to be changed and challenged. And I think I will leave it at that and come on to the next person who's got the hand up. And I think Serena Craigie was the first one. So Serena.
Okay. Thank you, Chair. Again, I want to mention the Postal Service, beg your pardon, and I reiterate, I'm just wondering what the results were, and also what the questions were and how they were led. We'd like to see some examples of that to see where it was going. The other point I wanted to make was, I noticed you made a reference in page 10 from 1.6 to 1.9 about the ratio of black and white IROs, etc. But there's no percentage of the BAME ones that are actually black and white, etc. So I'd like to, I beg your pardon, are black, male, female, sorry. So I'd like to know what that percentage is broken down. The other one is page 14, the table 4. So I'm just interested for what were the reasons for not meeting the targets that were set, and also why was the targets at 100% for this year but didn't quite make it, the targets to be just slightly under 95%, etc. So if you could, that's mine. Thank you.
Right, Councillor Ridney, please.
Yes, thank you. Mine just general. All of these tables are up to March 2020. I appreciate that that's what the report's based on. My question for you then, in light of lockdowns and the pandemic, what effect do you think we're going to see on some of these tables? Certainly in times, how long stuff has taken to be done, in times, pressures and that sort of thing. Looking at the fact that this was up to our first lockdown, what are we going to see for this year? Let's get it out in the open. While you are going to have pressures due to the pandemic, I'm sure other people have got suggestions and criticisms to make, but what's the effect of this going to see on some of these figures?
Thank you for that, Sue. And now, Jasmine, do you want to answer these now or wait until the very end so every councillor can ask the questions?
Yeah, can I pick up on some of the points that have been raised now, because otherwise I'm going to lose track.
Yeah, I was just very much aware that you may become overwhelmed by this. So yeah, if you could answer up to like Councillor Ridney, then I will bring in Councillor Kerry Lewis after that. Thank you.
Yeah. So you raised a point, Councillor Millward, in regards to progress reviews and the fact that we're not currently monitoring and progressing that. That will change with the implementation of Liquid Logic. So that was predominantly around the electronic system we had accessible. And so, for example, with the dispute resolution, we were tracking that manually, but that didn't always give us confidence in the data. But moving forward for Liquid Logic, all of these templates have been built in. So in the next annual report, you will have reassurances there. In regards to participation, I did outline when I was talking that there's kind of 2 levels to participation. One in respect of children actively being involved in their casework. So that is about the IRO talking to children and young people before their meeting and in between meetings, which is taking place and is evident within the records for that child, individual child, but that's difficult to pull out and measure from our current electronic system. And then that's why we do things like the consultations to add to that. And I respect and agree in terms of the very low percentage of return. And one of the things that we're looking at in our participation strategy this year is how we can look at much more, because consultation is one level of participation at a service level, but actually co-production and actively involving children and young people in workshops to develop services is there's plenty of other methods that we need to be exploring, and that is going to be in our participation strategy moving forward. Clearly with COVID we're limited in how we work with groups of children virtually in terms of service development. I hope that responds to some of the concerns there. In regards to the percentage of BME workers that are male or female, if the councillors are happy, that's something that we can include in the next annual report. If not, I can look at getting data to you outside of this meeting. And in regards to the timeliness, we haven't seen a change in timeliness with the pandemic. We have continued to undertake virtual meetings and continue to see similar levels in terms of performance and meeting the targets that have been set. So that's been open there.
We're up to date with that one then now. So if I can call on Councillor Kerry Lewis, please.
I haven't got my hand up, Chair.
Well, it's showing. Yeah, your hand's showing. Oh.
Chair, I think that's someone from the Youth Council. It's Lewis Callery.
I'm sorry. I do apologise, Lewis. Yes, Lewis. Yes, okay. I'll call you in, please.
Yeah, sorry about that. I'm Lewis. I'm from the Youth Council. I was looking through the report the other day, and I came across section 2.2, and I've got a few questions to ask. So the first thing is, it says that the handbook says that Iro should speak with all children for their reviews. You've put here that 35% of young people are always offered the chance to meet, but only 28% of young people are only sometimes given that opportunity. So are they not always given that opportunity? What about the 37 young people who aren't covered in that statistic? That's my first question.
Okay. If I answer that then, those figures are from the survey, and one of your colleagues has just outlined at how the response to the survey was actually pretty poor. So those figures are in relation to the 6% who did respond to the survey. We don't have data on the overall cohort because of the way that data is captured within children's individual records.
Right, okay, then my next question is, it says 68% of young people were asked who they would like to attend the meeting. Why aren't all of the young people being asked that same question?
Yeah, and that's a good question. And this is why we do the surveys, to look at what our children's experience is of practice and which social workers are, because that's a social work task to ask the child who they want at their meeting. So it's about gauging those views and bringing that together to improve practice.
Okay, thank you. And finally, it says that one of your aims is to have more young people chairing their own meetings. It says that currently 30% of young people are offered to chair or co-chair their own meeting. So how are you going to raise this figure and encourage more young people to chair?
Yeah, it's one of the targets for independent reviewing officers, that they increasingly ask children and young people to, if they would like to chair their meeting, and provide the support and facilitation for children and young people to feel confident enough to do that. So that is a part of the IRO's current objectives within their individual appraisals, and that's monitored through supervision.
Okay, that's everything.
Okay.
Thank you.
Thank you, Lewis, and I do apologise for getting you mixed up with Kerry Lewis. Right, I'm calling on Councillor Perks now, please.
My point is the 3.4 paragraph, lack of social workers reports. I have it from good authority that the caseloads to social workers are very high, and it's very difficult for them to do proper justice. Even if they were fully staffed, it would be difficult. 2 years ago, extra resources were put in before Ofsted, and they had a good report. And but after the Ofsted report, the extra staff were taken away. So we're actually going backwards and not forward because of the lack of staff. How are we going to solve this problem?
Can I do you want me to respond to that one, Jasmine?
Yeah, I was going to invite you in.
Yes, thank you. Okay, so in relation to Kate, I'm not sure, I wasn't here 2 years ago, so I can't comment on that particular question. What we do know is, you're absolutely right, Councillor Perks, is that if caseloads are too high, our staff can't then do the quality of work, and Helen and I are very mindful of that. And what we have to look at within the care management service since I've stepped up in the service director role is where the gaps are with Helen, looking at where the gaps are to make sure that we can have caseloads that are more manageable. Obviously, we need to balance that with the budgets and what the budget that we have. So it's a fine line, isn't it? But we are wanting to make sure that social workers have a manageable caseload. Alongside that, what we're doing in social care is to make sure that I'm being clear with heads of service and service managers around that we've got the right cases that are sitting in social care, and if they can be supported at early help, then they should be moved into early help or into universal services. So there's a piece of work looking at that. So we're not just growing and growing in terms of the amount of cases, but we are proactively making sure we are absolutely working on the children that meet the level for level 4, and that where they can be supported elsewhere appropriately, that is happening. So we are mindful of that.
But we're getting more cases coming in. So unless there's extra staff put into these positions, it's not going to work, is it?
Well, in terms of, we've had more contacts, so like I explained earlier, we've had a surge in contacts, and I described, I'm not sure if you were on the call then, some of that is around anxiety around the pandemic. Some of them have come through to us and then they haven't met our criteria, so they've gone back down to early help. We have had an increase in referrals. We've had some more cases, but part of that is about an increase in cases, but a lot of it as well will be about how we support our staff to manage cases sitting in the right place. So whether they move into the right service within social care or whether they step down to early help. And that is a daily task. It isn't something that we resting on our laurels. It has to be on a daily basis. Team managers. So as a team manager, I would regularly be looking at cases within my team and thinking, is this the right case? Does it need to be here? Should it be moved elsewhere? Because I've always got other cases coming in and I need to make sure I've got the balance right. But it's a daily task for our team managers, and those are the conversations that we're having.
Thank you for that. Is this, when you say going into a different position, does this come into Leapfrog at the Children's Centre at Netherton? Can I bring that up at the minute? Because I've had actually about three parents getting in contact with me about Leapfrog.
Well, to be fair, that we look at that's part of the early years. We're actually discussing the independent reviewing officer's report, Christine, so it's not relevant to this report, I'm afraid.
Okay, can I bring it later, because I know it's not on the agenda?
No, sorry. No,
okay.
we've got to keep to the agenda, please. Thank you.
Okay.
Can I ask everybody to please mute and come off the video feed, because we're getting feedback here, unless you're speaking. Then I'll now call on Councillor Sahota, please.
Thank you, Chair. I think a lot of my colleagues have, I think a lot of my colleagues have actually picked up some of the stuff. Obviously, we are concerned about some of the issues and how we're moving forward in terms of the consultation with the young people, the staffing issues, the business support. And for example, with if only 12 people attended the workshop, that's 3% of the total amount of kids we got in care. Now, are we, is that really reflective, of the silent majority in terms of the, you know, if we're trying to tease out their views, etc. And then the other obviously issue I just want to raise basically is in the report for 2021, it obviously states there the actions, but it doesn't make it clear what the updates are on these actions. So, you know, I would have thought if this was a 6-month report, we would at least now have some updates in terms of on these actions, so we can then look at it and say, yes, this is what we said we're going to do. This is what we're doing. We're on track. But looking at this, it's just a statement of intent at the moment, but there's no feedback saying what we're doing, where we are. Have I read this correctly? And,
no,
there's no updates. So, you know.
Yeah, but the thing.
Can I respond? Sorry,
Yeah.
Chair.
Yeah, sorry, can I say, Armji, it is the actual annual review that goes from March 2019 to March 2020. So it's not like we would expect a 6-monthly review at this point, because it is the annual report. But yes, I do. With regard to this particular issue and lots of other issues, as Helen mentioned in her verbal update regarding the social care side of things, there are lots of there's lots of things going on. There's lots of improvements to be done. So I do think that you've got a very valid point that perhaps at another scrutiny committee or even one of our working groups, we would look at you know, where we are now, you know, a floating report. So you do bring up a very valid point there, but it is actually the annual review report.
Okay.
Just for clarification.
Okay. Can I just make one more point, Chair? Obviously, just want to clarify. Clearly, obviously, looking at the staffing structure in this report under paragraph 1.5, clearly there's 2 heads of service. There's staff there. I just need reassurance that the staffing is, if the staffing is there, then we should be able to unpick some of these issues we have got. Because if not, you know, are there underlying other issues that are not making us deliver what we need to deliver? You know, that's what I'm trying to get to the bottom. You know, like admin or social workers can't do reports, etc. If we got 2 service managers for this unit and you got all the staff, then there really shouldn't be any reason why we cannot deliver what we said we're going to deliver, unless there's underlying issues underneath the surface, which, you know, people like yourself we need reassurance. Are there other issues?
Andrew, do you want to respond?
Yeah, I'm happy to respond to that. I'll lower my hand now. So just a couple of things really. So Councillor Sahota, just on the annual report, because I presented the annual report last year and we talked about that then, and it's come up again this year. So I think we do need to have some way of, so the annual report is absolutely for a fixed period in time, but it like Councillor Millward said, it's probably worth having something that comes as an in-betweeny thing where we're able to update, because it does feel a bit odd, I suppose, when we're updating on something that by the time it comes here is 6 months old. So I do agree with you, there's probably a way of us doing something a little bit different, but it is fixed in time for the end of that year. From my point of view, in terms of the participation strand, so I know that we have much to do in terms of the participation and engagement, but what Jasmine has been describing is what we've started is a participation stream, and the point of doing that is absolutely in recognition of the fact that we haven't been as effective in terms of getting the voices of children, young people and their families, and importantly using those voices to improve our work and to shape our services. Hence the fact that in August I chaired that first meeting to start the work streams, and then Jasmine's moved and set those up to have children, not just children in care, but all of the children that come through our doors, that we're able to look at how are we including them in that. So as part of our improvement plan, what the concerns that some of you have highlighted today, we absolutely know that that's not good enough, and it's part of our improvement plan and the service plan for the safeguarding and review unit. I'm really passionate about us getting the views of everyone and how we use those views, and certainly when we're having meetings, I do talk about that a lot. So I get it that we're not there yet, but we have started on a journey to move from where we were, where it isn't just children in care, but we're looking at all of the children that are open to us. And as you refer to them as the silent majority, we are very mindful of that. We have a practice week coming up in first week in December. And although we're in lockdown and we're going to do it virtually, we are thinking, how can we get views of children and parents and engage them? And in authorities that are good, they do that routinely, and we are mindful of that and very keen to do that. So those are just the responses to some of the things that have been raised previously.
Okay, is that all right, Pomjit? Right, Councillor Ridney, please.
Sorry, I haven't got my hand up.
You have.
Oh, blimey, okay. Must be left from the last time. I do apologise.
That's all right. Is there anybody else? Christine had her hand up as well. I don't know whether she wanted to speak again.
No, thank you, Anne.
Right.
I took it down.
Okay, thank you. Right, so thank you very much for that report. There's quite a lot being discussed there, Jasmine, so thank you for that. And the recommendations of the committee are that we note and comment on the content of this report going forward, and also, as being requested, that we do have some sort of in-betweeny, as suggested by Andrea. So thank you very much indeed for that, Jasmine.
Thank you.
Chair,
Right.
can I just interject? Did you want a resolution? Did you want a resolution in relation to consultation and the RROs conducting consultation with children when they have their reviews?
Yes, I would actually. If you could pop that into the recommendation, because if they are doing their reviews, then that is, to me, when you've got the child, the young person in front of you, that's the time to sort of say, right, we've done this survey. We want your views. We want you to be open, and we want you to be honest about this. So yes, can we put that in the recommendations that we include that when they do their actual review? Is the committee agreed?
Yes.
Yeah, yes, agreed.
Thank you.
Yes.
Right, thank you, Kim. Yeah, that's fine. Is that okay?
Yes, thank you, Chair.
Right, thank you. Then, so we move on to agenda item 8, which is the fostering and permanence service updates, pages 24 to 29. Now, who's going to be presenting that, Helen?
I'm doing that, Councillor.
Oh, it's you, Andrea, sorry.
It's me. So at the moment, there isn't a head of children in care in post. We have got somebody permanently recruited, and she's starting next week. So I'm it for the next 2 items.
Right.
Okay, so fostering and permanent service. So the report starts with a bit of a summary around the fostering service. So within the fostering service, we have the recruitment and assessment team, and the mainstream fostering support team. So that team supports the foster carers. The recruitment team does all the recruitment for foster carers, and we're trying to do some additional work to think about how might we continue to increase the range of foster carers that we have, and also foster carers that can support us with some of our most challenging children. So we are looking at doing a piece of work around that when the new head of service comes in to lead on that piece of work. We've also got the connected persons team. Now, connected persons are somebody that's known to the child. It might be a relative or a friend. And we do have a duty by law, if a child is coming into care, to consider whether they can go to a safe relative or friend rather than being placed in foster care, for example. So in terms of permanency options, so you might hear the term permanency sometimes. So that means it's like their forever family. So what's the forever plan for the child? Permanency can also be returning back home to family if it's safe to do so. So for permanency, it's special guardianship orders, where a child might have a special guardian through a legal order that they will look after them until they reach the age of 18. You might have long-term fostering, where the child is not going to be adopted. Adoption isn't a plan, but they're not going to return home either. So a permanence plan can be long-term fostering, or for some children, the plan is for adoption. And for those cases, we work really well. You may know that we have a regional adoption agency in the Black Country that's shared between ourselves, Walsall, Sandwell, and Wolverhampton. So we are working really tightly with the RAA, Adoption at Heart they're called, to make sure that we can progress appropriately when that's the plan for children to be adopted. So there's a section in here in this report that gives you some of the numbers at the time that this report was done, which probably was about 2 or so weeks ago, that there are 635 children that were looked after at the time. And I did ask for it to be put in there, a breakdown at the time in terms of what types of placement those children were in. So you'll see a breakdown there of which children are internal, which children are external, and which children are with connected carers or are in adoptive placements. And then there's some further description there in terms of some other children that are in other, they're considered as looked after, but they're in other situations such as secure units or youth offending or residential school. We had one child in a residential school. So we have about 50% of our children are in our in-house provision. Obviously, that means 50% of them are outside of our internal provision. And what we are doing, it doesn't say that in this report, but what we are doing is to work with our commissioning services to start a piece of work looking at our sufficiency strategy, so we can think about what are the needs that we've got in terms of our looked after population. And children coming into our care or about to come in our care, and how can we try and make sure we've got the right provision for children so we can have more children internal, and if the decision is made for them to go to an external placement, there's good reason for that to happen. Now, this is a challenge for all local authorities, not just Dudley. So wherever I've worked, it's a challenge in terms of trying to think about the balance between internal and external, how we can meet the needs of children. And sometimes you do need a sort of a specialist placement that the local authority might not have the provision for, and in those cases you have to go out. But what we want to do is make sure that we're absolutely, where we can, keeping children in Dudley. It's better for them to be nearer to the place where they live, where their school is. So that's a big piece of work that we're starting, and it's a priority for us in terms of the senior leadership. So I've talked about the recruitment team, the mainstream team, and the connected persons team. So in terms of the health, emotional health and well-being, we've got a service called Dudley Lighthouse Links, which you may have heard about, and we have a service level agreement with them. That team has been in place for about 18 months now, and it's been done in partnership with the CCG. So we have psychologists in there, we have social workers in there, and support workers. So it's for looked after children, and it is a way of us providing that support to them when there are emotional challenges for them, or they need some therapeutic work. So that's been going for a while. We are going to look at reviewing that and evaluating that service to make sure that it's meeting the needs of our children, it's doing what we think we need it to do. So that's something that's going to be started, and we've had some conversations about that already. But when the new head of children in care comes in, that's on the list of priorities in terms of those initial conversations that I'll be having with her. Just back to permanency again. So permanency is a big thing. So in terms of children coming in, avoiding drift, making a decision about where they should go. So if you imagine a child comes into care, they've left their family, it's really important that if they're not going to return home, or if they are going to return home, that we are able to make some decisions as quickly for them, so it reduces the impact emotionally of them being in foster care or the uncertainty around that. So permanency for any local authority is a priority for social care, and for that we've strengthened some of the meetings that we're having around permanency monitoring, achieving early permanence panel, and really tightening the time frames around that, so that we making sure that as managers that we are regularly looking at each of those children. Where are we with the assessments? Where are we with the assessments of families? Can they go home? If they can't go home because assessments have been negative, what's our next plan? And that we are proactively moving through those plans. And there's a little bit of a summary at the end of that bit in terms of where children are in the adoption stages. I'm the agency decision maker in relation to adoption, so I will make all the decisions around whether a child is matched with a prospective adopter. So I do the matches and approve those matches and send them back to the RAA. I also, if the plan is for adoption, then it comes to me as agency decision maker, and we have a discussion there around, is it definitely the best plan? Within the legislation and the courts, the expectation is that we only go for adoption if there is no alternative, so that nothing else will do. And that's the decision that I make with other people around the table, and also with legal services and seeking their advice. So it's, as you can imagine, it's quite a big decision to make in a child's life, and I take that very seriously. So there are lots of questions and lots of gathering of information in terms of making sure that the right questions have been asked in relation to family members or any connected persons that could have cared for that child. So in terms of the equality and impact bit, so you can see in there, you know, we are trying to make sure that we've got a mixture of foster carers, and as part of that recruitment and retention work that's going to be started, is really thinking where we can, we try and get a mixture of, you know, our children are a mixture of children, so we want to make sure where we can that we can and have a mixture of foster carers to meet the needs of those children and be quite diverse, as we expect to be as an employer in general. We'd want to be diverse, but certainly diverse in terms of carers offering to care for children. So that's it in terms of that report, and then I'll stop here.
Thank you very much indeed, Andrea. Can I just ask you a couple of questions, please?
Yeah.
With regards to page 28, item 11, with the number, are all those separate numbers? So in total, we've got 39 children there, or all are like 11 children at the bottom, part of the 15 at the top. Could you just clarify that?
Yeah, they're separate. So yeah, they're separate children.
Right. So
that would be a snapshot of that at that time.
Yeah. So we've got we would have 39 there that would be looking for adoption.
Actually, sorry. I think you're right. That's a good question, because when I look so when I look at the 4 children in foster and adoption placements, foster for adoption, they're still children for adoption. It just means that they have been, the good thing about fostering adoption, and I will tell you what it means because I think it's really good. So the last few years, the legislation was changed. So whereas children would come in now and be placed in a foster placement, and then the plan would be for adoption, and then they'd move to an adoptive placement. And quite often those babies, for example, have been with that foster carer for a long time. With fostering for adoption, we have adopters that are willing to be foster carers. So they may well, I signed off a match yesterday for a child that had been placed with the foster for adoption carers from birth because they couldn't go to parents. So now the adoption order's been made, that baby doesn't have to have a move. But yes, I can see those numbers could be a bit clearer, Councillor Milborn.
Yeah. So it could be that there's just 15 children in effect. If I could just have some, you know, if you could just get to the clarification on that one. And yes. Do we still have the adoption panel, or does that no longer exist?
We do.
You do? Because
we have. Sorry, I think we're on a lag.
Yeah, I sat on that panel in the early 2000s, you know, and it was an absolutely, it was a wonderful experience. But I know that things change over the years, and at the time we did have quite a few children who needed adoption places, and it was very strict at the time that, you know, you would not place children, you know, from a BAME background with white couples and vice versa, and it was always a concern of mine that, to me, yeah, I understand cultural backgrounds and that, but we had very few people from the BAME community who were approved adopters. And it used to be that the children were languishing in the system, where you know, a family was there willing and ready to take them and love them and make them their forever home. And I just wondered what the thinking is now, because as I say, you know, things change over the years. What is the thinking around that now?
Yes, so we wouldn't have children languishing, but in terms of the RAA, adoption at heart, I saw an email from the head of service there, Mark Tobin, that he'd sent across to the regional service directors, me being included, about a lot of activity. He'd said we're doing lots of activity in terms of trying to increase the diversity for adoption, and I did go back and say I'd be interested to know what's been done around that and maybe to be part of that. So that was probably in the last week. But yeah, so we wouldn't want to have a child not have a forever family. So ideally you'd want to try and have an ethnic match where you can. I do think that's important, but if the alternative is not having a permanent family of your own, then I think that's not ideal either. So I think we've got to be pragmatic about it, and I do think it's a fact that certainly within the BAME community there isn't as high a rate of adoptions, of people putting themselves forward for adoption, but I'm mindful that the RAA have got some activity that they're doing around that, and I've been saying I'm keen to know what that is and to be involved in that from a Dudley perspective.
Yeah, I think that's very important. Thank you for that. So when you do find out, would you share that with us, please?
Yes, yes.
Councillor Ridney, please.
Thank you. Just a couple of points for clarification, really, Andrea. Page 25, I'm assuming that the last two numbers in the list you give there, the 25 that are living in semi-independent living and 7 in independent living, we're talking about our 18 to 25 age group.
Yeah, so the 7 ones are definitely 18 plus, so they're independent, but they'll still be being supported from their YPAs, their personal advisors through the leaving care team.
And I just wondered if you could give a bit of clarification on what you term as semi-independent living, really, just to reassure members on what we're talking about. Because there has been a lot of interest in unregistered homes and things, which is quite a concern. I'm really glad that you emphasise the fact that we do want to have our children within the borough, because that's politically quite what we have always tried and said that we want to do for a number of years now, that we want our children that are in care to actually be placed within the borough. I know there are some that can't, and my other point, paragraph 11 on page 28, the numbers you were just talking about with Councillor Millward there, is that about an average figure that we have, or is that being influenced by the fact that the courts have got quite a backlog at the moment?
Sorry, I am here. Okay. So I was getting my bearings. So in terms of the semi-independent, so that would be those, sort of 16 plus that are in semi-supported accommodation that aren't regulated by Ofsted. So that's what unregulated means. Ofsted do not regulate 16 plus, although that's been debated across the country in terms of whether they should be, and I think they should be, personally, and a number of other people within the profession think that too. So for our within Dudley though, so whilst in some local authorities they're placing on the 16s in unregulated placements, we would never do that, and we are working within children's social care and in commissioning and with other colleagues across the council to look at those. So I think it's Safer Estates, or one of the there's a forum where we look at those unregulated placements and that they're being visited and seen, and you might have seen some activity around some of that. So it is high on our agenda. We don't want our young people to be in any place where they feel unsafe, and there is a lot of rigor around that. But it's not just children's services, like I say, it's right across. And we work with our police colleagues as well, who are in those forums as well. So if anything comes up about a particular home in a particular area and there are challenges, those on a monthly basis, those residents are being talked about, and supports are being put in place, and it's been alerted across the council. There's still more that we can do, and we are really mindful of that. So in terms of the semi-supported, I think we talked previously, Helen talked previously about our improvement plan and our work with commissioning and looking at semi-supported and making sure we've got absolute rigour around that, and we are happy with all of the placements that we put our young people in, is part of that work stream. And we've been talking about that in the last few days with our commissioning service. And the other bit, sorry, Councillor Ridney, can you just, was that about the adoption numbers on page 11?
It was it was just about the numbers there that Councillor Millward had referenced. I was asking if that was, the 39 was an average sort of number for these children that we're talking about, but is that being influenced by, at the moment, there is a backlog within the courts due to the pandemic?
It is an average number for Dudley. It hasn't been impacted by the backlog for the courts because we've still been able to do that. But in Dudley, there hasn't been there's two things. There hasn't been the right amount of rigour in terms of our progressing permanency, which is what I talked about earlier. So our adoption numbers, you could say they were probably lower than they should be. But in addition to that, and we're doing some work in terms of how do we tighten that up with our relationships with the RAA and the meetings that we've put in every 2 weeks to look at all of our children where adoption is a plan. But also the complexity within that is that we don't want to be progressing adoption where there are family members and alternatives, and the court won't allow us to do that. So whilst the numbers may seem low, we're doing some work to make sure that for the right children, where it absolutely is a plan of adoption, that we are progressing that in a timely way. But then we have all, sometimes when we want to, sometimes it's appropriate for us to be working with families to see whether the child can return home. And we're doing we have a project called the Reflect Project, where we work with moms where they've previously had a child removed, but with support they could maybe keep the next baby with support, and we work across the partnership to do that. So it isn't as straightforward as saying let's increase our adoption numbers. It's let's increase our adoption numbers where it's appropriate, but where children can return home safely with support, then we should do that.
Okay, thanks very much for that. Thanks.
Councillor Sahota, please.
Just a quick question, Andrea. Obviously, in terms of the 50%, obviously we got our in-house and 50% are with external agencies. How does that compare with other councils? And what is it better practice to have more in-house because that gives us better control and better sort of reassurance? Or is there no magic number and it depends on each locality and local authority in terms of the resources?
I think we're about the same as other people, and I think it's a national problem. And in fact, in the last few days, the government's launched a review, which will be a major review, which everyone will be anticipating in relation to care, and it's specifically around care and provisions and sufficiency and accommodation for children, because it's such a significant area. And like I say, not just one for Dudley, but we are convinced that it's something that we need to focus some attention on, so that we can be satisfied and in saying, if it is 50%, is the other 50% absolutely because it was appropriate for the child's needs to be elsewhere, or how much of that is about us not having sufficient provision? So that work hasn't started, but we have a plan to start it so we can be more confident. Whereas at the moment, we feel that it could be that, I believe that we could bring more in-house and we could do better. And we are looking at the way that we look at our sufficiency strategy, but also in the way that we have our panels around placements and where children go, that those panels will be chaired at a senior level by Helen, and I'll be on there in heads of service. So we're just lifting the status of our resource panel, so we are getting our heads together, so to speak, and really making sure that for every child, is this the right placement? Was there an alternative? How are we thinking about the wider picture around how we have provision for children that's appropriate?
Okay, thank you.
Helen, you've got your hand up as well.
Yeah, I think just in support of what Andrea's just described, I think for me, I just want to reassure Scrutiny that within our improvement plan and over the next few months, permanency is an absolute priority for us. This area of work is immediate, and this work is what we're going to be driving this through to improve. So I just want to just reassure Scrutiny that over a period of time, we'll be able to bring more information here, and just to say within our plan, it's one of our immediate actions. Okay.
Yes, and thank you very much, Helen. That's great. And thank you, Andrea. So there's nobody else indicating they wish to speak. So the recommendations are that the committee note and comment on the contents of the update on the fostering and permanent service. And if we can add another recommendation that we get further updates as the municipal year progresses. Is that okay, Kim?
Yep.
Okay, thank you very much, Andrea. If I can now move on to agenda item 9, which is care leavers report, pages 30 to 34, and it's Andrea again.
Hello, everyone.
Hello.
Okay, so I'm doing the care leavers report. So this report has been prepared by the service manager for care leavers, but obviously I'll go through that and take questions. So care leavers are defined as 16 to 25-year-olds. So as you know, for some of those children, we'll offer support to them until they're 25, which is really positive, because if we think about our own children, we wouldn't just sort of kick them out at 18, hopefully, but that we offer support to them to 25 and sometimes much longer than that. So we are their corporate parents, so we take that responsibility very, very seriously. In relation to we have a care leaver strategy that was done in 2016, and in there it summarises, and I will just say the 4 key points around being better prepared, for young people to be better prepared and supported to live independently, to have improved access to education, training and employment, to experience stability and feel safe and secure, and to receive improved access to health. And achieve financial stability. So that's really important, that we really trying our best to adhere to that and support our own young people. The Children and Social Care Act 2017 brought in some additional things. So we've now got a local offer for young people, which is on the website. And there was expectation that the role of the personal advisor would be strengthened to really be supportive of our young people. And I have to say, when Ofsted came in, they did comment on that they'd seen lots of really good examples of our young people being supported during the pandemic, during COVID. So we were really pleased about that. And I think we've spoken in a previous scrutiny about how the use of WhatsApp, for example, has been an additional way, as well as seeing young people face to face at a distance. But WhatsApp has been an additional way of communicating with them, which they've really taken to. So in terms of the team, there are 16 full-time young persons advisors within the team, and 2 team managers. Within the report, it sets out under the Care Leavers Regulations 2010 what we're meant to offer in terms of support, and that is advice, support, coordinating the provisions for the young people, and just making sure that they're supported in every way in terms of their health and their education, and having someone to talk to. And there are some really strong relationships between the personal advisors and the young people, and quite a bit of consistency there. And I think that's something that we should be proud of in Dublin. It doesn't mean we're resting, but there is a lot of commitment from our personal advisors, which is important for our young people. So in terms of the report goes on to talk about 18 plus, and that the expectation for YPAs then is to provide general assistance, again help with expenses associated with employment, education and training, and accommodation. There are quite a few good initiatives in Dudley for young people, so they get council tax exemption, and for care leavers up to 25, which is really positive. We've got 16 young people that are at university, and I think that is really good. And we've got one that's doing a social work degree, so clearly there's been some positive views in relation to what social workers can offer for a young person to want to go into that profession themselves. And we have young people working in a variety of roles, children's nurseries, one's gone into law, and health and social care. So we have got a number of young people that are going to university and into higher education. And again, in those situations, we help them with accommodation, maybe furnishing their accommodation, television, making sure they've got books and equipment and travel costs. So we are wanting them to have the opportunities that any young person would have if they were at home with parents, to make sure that they're not disadvantaged in that. And if they want to go on to college or university, that we're absolutely supporting them to do that. So in terms of caseloads within the care leaver service, the caseloads have gone down. They were at 29 to 31 cases last year, but they're sitting around 23 and 25 now, which is really positive. And the service manager talks about really aiming towards a caseload of about 20 if we're able to do that. So each of the team managers within the supervise on a monthly basis the YPAs to make sure that they've got the level of support that they need to be able to do the good work with the young people. In relation to education, employment and training, so this figure is 50% of young people. That's kind of consistent with the performance nationally and regionally, but that doesn't mean that we don't want to improve on that, and we are looking at doing some work around that, and looking at we have some money that's been given to us by the government, and hoping the service manager suggested using that to get a dedicated person that can do some dedicated work around increasing young people that are in education, employment and training. That is for a fixed period of time, but it will still help to maybe give a bit of a boost to that particular area. The Black Country Impact, I'm not sure if you're familiar with them, but they're an organisation not just for children looked after, but for children in Dudley in general between 16 and 29 to help with education and training. And some of our young people are engaged with that organisation. One of the issues that we've had is trying to think about identifying a place for young people, young care leavers to go to. Obviously, we're in we have some COVID restrictions at the moment, but we are still thinking about what we can do so they've got somewhere where they can go and meet with staff, and that's an ongoing issue because we're balancing safety versus somewhere for young people to go and see someone. But it is important that there is somewhere where young people can meet with their YPAs and the staff from leaving care. So it's definitely on our agenda, and we're trying to think about how we can make sure that we can meet those needs for those young people. In relation to our local offer and pledge, so in thinking about how we engage young people more, we'll be trying to get some care leavers to be involved in that, so that they can be part of developing the local offer and the pledge. So we're looking at getting them involved in that piece of work, looking at how we can, in the Centre for Professional Practice, what we're also doing, it isn't in the Vision report, but I've just thought about it, is we're trying to get an apprentice, a care leaving apprentice that can come and work in our Centre for Professional Practice. So we're just sorting out the job description and the finances for that, because I do feel that if we, as corporate parents, that we should be the first ones to try and make sure that our young people have opportunities in terms of employment and training, and that we are, as a council and as children's services, part of that plan. Yes, that's it in terms of the care leavers report.
Thank you very much indeed for that, Andrea. I mean, I'm really pleased that we offer and we do offer quite a lot to our our care leavers, and you know the good work that Councillor Paul Bradley did in his former position of chair of the corporate the children's board, you know, pushed through, and we managed to get it through by this committee, the exemption from the council tax. So that's really good. I'm really pleased to see the number of young people as well that are at university, because I can remember, and Sue Ridley will back me up, we had one girl, the very first one years ago.
Yes.
She was the first one.
Absolutely. Yeah.
She came to full council and
did.
had an award, didn't she? But she did
did,
want to go
yeah.
on a gap year, which they couldn't find the budget for. She wanted to
No.
go around the world. But the very fact that we've got 16 young people is wonderful. Yeah. The other thing that are picking up on one of the points you've just made as well, Andrea, is that we've still got 50% young people who are NEETs, and the data says it's between the 18 to 20 cohort. And we've talked about this over the years, about offering apprenticeships within the council, but we have partners. We have, you know, the council, the health authority, the police, fire, all these big organisations, public sector. You know, surely we can get some work going with them to engage young people, some of our care leavers, to look at professions, and you know, even if it's, you know, working for our housing teams, for example, for doing and our contractors, you know, can we look at ways of ensuring that contractors who come to the council could perhaps be encouraged to take on one of our young care leavers as an apprentice, you know, like, you know, dangling a carrot as such, and I don't mean it in a dodgy way, but surely we have so many contacts as a local authority that we can push this, and I do think that's something that we need to look at, and I do believe that Councillor Whitney's got a hand up next. So
absolutely.
Do you want to answer at the end, Andrea?
That's fine.
Yeah.
I just want to say, I think the place to bring this, where we can do more work, is the corporate parenting board. I would be very, very much in support of finding somewhere where care leavers can have a drop in. And as Councillor Millwall's just been saying, we have raised this before, that we should be recommending to Cabinet that when they are procuring contracts or giving commissioning contracts, that part of the negotiation should be that you are willing to take on apprentices from our care leavers, and I do believe that we should be pushing that wholeheartedly. But I would be very glad to see some of the requests in this report come to the corporate parenting board, because I think that it would get a sympathetic ear there, because that's where and I would like to say, echo what Anne said about all these children at university now. That is brilliant. I remember when I was sitting in council that one, and we thought that was amazing, but this is really, really positive. So but please come to the corporate parenting board with some of these requests, because we now have the ear of Cabinet as well.
Yeah, great. Yeah. Councillor Sahota.
I just want to echo, obviously, what Sue and Anna said. It's really positive report in terms of, you know, the outcomes some of these young people are sort of going into. In terms of some of the information, I just want to clarify, Andrea, would it be good to find out in terms of data what the young people go into? So we got like a you know, is it work, education, voluntary, whatever? You know, that'd be good way to sort of capture what kind of fields they're going into. Would that be possible?
Is that in relation to their studies, Councillor Sahota, the ones that have gone on to further education, or
education, or if they've gone into sort of work? What are the outcomes? You know, are they do? And the other thing is, what's the profile of the YPAs? Are they young, old, female? You know, it must be a very interesting, worthwhile job supporting these young people.
I don't know. I don't know, but we can find out. I can't imagine. Well, I won't make any comment. But I can find out. I don't know.
Okay.
But I don't know whether Helen, in terms of the virtual school, and can you hear me, Andrew? Right.
Yeah. We can get a breakdown of all the destinations. That's not an issue at all.
And I think the last point I want to make, which I think you said you're sorting out, is we do need a base You know, obviously reading the report, they're crying out for a base. Obviously, I know we got the COVID, but as a council, we must have assets all over the borough where we can somehow use with people that can make appointments with their YPA and meet up. Because I think if they, you know, if they want to meet up, I think it's something we need to sort of look at, try to sort of tick the box. And like you said, it's work in progress, but that really would be useful and positive. And thank you for the good work.
Thank you. I'll
Yeah.
pass that on.
Oh, I've got...
Sorry, Anne, can I just
Yeah, of
ask
course.
Helen, is the children's home at Briley Hill still sitting empty?
The one at Briley Hill closed a few years ago, so
I know, but is it still sitting empty?
it is empty. I don't quite know what's happened to that build, but I don't think it's occupied.
I don't think it is. There you are. It was Children's Services building. Bring it to the corporate board. We'll discuss it.
Okay.
Yeah, that's. Could I just ask? I don't know whether Andrea or Helen knows this off the top of their head, but with relation to the needs, I personally would imagine that the majority of them are young men. So I'd be interested to see the breakdown on that. You know, I am assuming, which you should never do, but in the past it's usually young males that are in that situation. So if somebody could get back to me on that. What I'd like to say now is there's nobody else indicating to speak. Thank you very much for that report. And as Scruitny has pointed out, I've had the invitation now to go to corporate board. And I do think that there's quite a few issues in here that we need to take there, because it now is a constituted committee, isn't it, Sue?
It is, yes.
Of the council, where we've probably got more teeth than ever. And I'm just going to mention for the records, because I've been banging this drum for years and we've never gone anywhere with it. We do need to start looking at a champion for children in care, and I will be bringing that up at the corporate board. So the committee has recommended that we note and comment on the content of the update and on the care leave of service, and thank you very much indeed for that report. We move now on to agenda item 10, which is to consider any questions from members to the chair where 2 clear days notice has been given to the monitoring officer. Council Procedure Rule 11.8.
There are none, Chair. There are none.
Right. Okay, thank you very much indeed. So thank you everyone for attending this meeting. I think it's very, very productive. Some very good reports on there. And I don't think, we're meeting again for full council, but from this committee, can I wish you all a very Merry Christmas? And I hope to see your Christmas trees going up soon. You know? We need some cheer at the end of this year. And it's as
Yes,
I said
we
to
do.
somebody,
We do, definitely.
I said to somebody yesterday that this country hasn't seen a darker year than that of 1944. When everybody was in the blackout and there was no lights, and we've had a very bad year. So get those decorations up and let's light up Dudley. So thank you very much, and I'll see you.
Thank you, Chair. Thank you, everybody.
Bye.
Thank you, Chair.
Bye.
Thank you.
Everyone.
Bye.
Bye. Bye.
Bye. Bye.
Bye. Bye.
Safe, everyone. Bye.
Karen.
Hello.
Oh, God. Oh, God. I feel like I'm on a mission.
Put your camera on.
Hang on here.
I've just had to remove everybody that don't remove themselves.
Oh, God. It was. Anne Norwood was sending me a message to say, can you let Christine Perks in?
Yeah.
And I thought, I'm going to have to text Karen so I didn't get off the notes down when Ellen Ellis was speaking because of that.
Well, I was on it, don't worry.
Oh, Karen, you've got to end the recording.